answer session. For today's event, we are joined at the table by Premier Dwight Ball and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Good afternoon again, everyone. Minister Agee will be in the House of Assembly again today, as the Assembly is now sitting for maybe what will be the second last day. It will sit again tomorrow. So pleased to be joined at this table again by Dr. Janice Fitzgerald, our Chief Medical Officer. So I will now turn it over to Dr. Fitzgerald for today's update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us. So since the media advisory yesterday, we have no new positive cases, and the total number of cases in our province remains at 261. 257 people have now recovered, and we have tested in total 15,143 people. So we are now midway through the second week of Alert Level 3 in our provincial Life with COVID-19 plan, and by all accounts, things are going as hoped and planned. If we stay the course and all continues to go well, on Thursday, June 25th, we will move to Alert Level 2. Public health officials are working diligently to develop guidelines to support the reopening of more businesses and activities in Alert Level 2. These guidelines will be available on our provincial COVID-19 website at gov.nl.ca/COVID-19 in the coming days. Today, I would once again like to express my thanks and gratitude to each of you for your patience and cooperation as we continue to navigate this challenging time. We are here today because of you and the actions you've taken to keep you and your loved ones safe, and the trust you've placed in our public health system. Every public health decision made to date has been done so thoughtfully and with careful consideration of your health and well-being top of mind. And as we learn to live with COVID-19, our public health officials will continue to balance taking the necessary measures with allowing ordinary life to continue as much as possible. Moving ahead to Alert Level 2 in the coming days will require the same coordinated efforts that have brought us this stability back into our lives. We've already seen what we can accomplish by working together, and I know we are each ready to regain even more of the freedoms we have temporarily lost to COVID-19. And we can do this, but we must do it carefully and smartly. As public health continues to do its part, please continue to do yours. Stay home if you feel unwell, cover coughs and sneezes, practice good hand hygiene, and maintain a safe physical distance of at least 2 arms lengths from others when in the workplace or public spaces. When keeping a safe space from others is not possible, it is highly recommended that you wear a non-medical mask to protect others around you. Let the 4 words people, place, time, space continue to guide us moving forward. We know the greater number of people we interact with, the greater the risk of spread of COVID-19, and physical distancing is pivotal to reducing our risk of contracting the virus. The longer amount of time spent together, the greater the risk of transmission, and it is less risky to spend time together outdoors than indoors. As a recap, for those who may have just joined us, we have no new cases since yesterday's media advisory, and the total number of cases in the province remains at 261. We have faced challenges so far from COVID-19, and there will be more to come. However, we will continue to see this through and build a healthier, stronger future for ourselves and for our loved ones. So hold fast, Newfoundland and Labrador. Thank you.
Thank you, Dr. Fitzgerald. Hold fast, Newfoundland and Labrador. I think these are kind of the sign-off words for Dr. Fitzgerald of late, and it's great to hear, so thank you again. So once again, for those that are just tuning in to this COVID update and this briefing, Minister Hagee is in the House of Assembly, as I just mentioned. But today marks 20 days since no new cases of COVID to report to our province. And after doing some reflection this morning, today also marks day 101 that we've been working through this pandemic together. So it's been Pandemic 101 in many ways today. Now, we have accomplished some great work during the unprecedented and this challenging time. As we know, it's by working together that we've been successful. We've managed to keep the virus at bay in our communities and protect each other as best we can. Your efforts in following the health measures, as Dr. Fitzgerald has said, you need to be commended, and it's been inspiring to many. It certainly has been a remarkable sense of community throughout our province. And people are noticing, by the way, all over this country what's happening in Newfoundland and Labrador. Our government and the health officials continue to work diligently day in, day out to put supports in place for both residents and for our business community. A big focus, of course, is on mental health and the well-being of our residents. With information on mental health and COVID-19 scattered all over the internet, finding accurate information and appropriate resources can be difficult and can be confusing for many at times. So that is why we've been pointing you towards the trusted websites like the COVID website and Bridge to Gap. And we keep saying GAP, GAPP.ca. And so why we do this is because this pandemic has had an impact on people's mental health. There's been anxiety, there's been stress, and there's been isolation by many. And we have seen reports that are coming during this pandemic regarding a spike in calls to phone lines and kids' help phone. And this is not unique to Newfoundland and Labrador. This is something that's been happening right across our country. So we're grateful in support from Kids Help Phone nationally to complement the supports that we offer here provincially and locally. This includes Strongest Families, Breathing Room, Bridge to Gap, as I just mentioned, Doorways, and many other programs that our regional health authorities and our dedicated community agencies are supporting. What we have to remember about a rise in calls, however, it tells us that the supports and the resources are not only available, but they are being used. So what's interesting is that young people who reached out through the crisis text line powered by the Kids Help Phone have also shared some real good, valuable information. 91% of them said of the users felt better immediately following their conversation. 67% said that they would not have reached out to anyone else for support had the service not been available to them. 59% shared something with us and those that took those calls and answered those text messages that they had never shared with anyone else. So this tells me that people are listening. And in addition to the supports that I've just mentioned, in May we added a youth page to our COVID website. It's a new website that was specifically targeted for youth aged 13 to 17. That's the audience that we had in mind when that was produced. Now, as we approach, and we've just heard some good news, as we approach level 2, and as the weather gets nicer and we recognize our younger population will be active outside and coming into contact with their friends. We also know that this is an age group that they have many questions. Like adults, their mental health has been challenged during the pandemic. So it's not easy when you can't hang out with your friends like you typically would. With that, we've engaged the Premier's Youth Council, and I got to tell you, this is a remarkable group of young people that we often chat about things, of all things, around Newfoundland and Labrador. We also reached out to Thrive when creating the page that I've just mentioned to make sure that it speaks to the age group and it resonates with them. By adding this youth web page to our COVID website, young people throughout the province can now access information in a way that speaks to them. Social media, as you all know, allows us a particular avenue to reach this age group. We are working with the platforms that target this age bracket, platforms like Snapchat, TikTok, YouTube, Instagram, video games, just some examples of the platforms that these young people engage with. So this is an opportunity to catch their attention with quirky and sometimes fun information on their home turf. So once again, Newfoundland and Labrador is leading the way as we're among one of the first provinces in Canada to specifically recognize this age group with a customized web page. So if you haven't seen it, visit our youth web page at the COVID website. There are also a few things to remind you as you head into this long weekend. The Canada Emergency Response Benefit will be extended for another 8 weeks. This was important. So this is about recovery and the reopening mode for our provinces, and that people still require, and often in many cases, still require this CERB to pay their bills and put food on their table. And I will say that as a Premier of Newfoundland and Labrador, we've had many discussions with the federal government and asking them to make sure that they phase this program out. And of course, this is a response, and which is good news for many people who are still not back to work. This is one of the many supports that's been available, and there are other areas to support students, like the emergency student benefit for post-secondary students and recent graduates, and we congratulate, by the way, our graduating classes. There's also been changes to the Canada Summer Jobs Program that includes an increase to the wage subsidy. Also coming on July 6th of this year, there will be some special payments for seniors throughout Newfoundland and Labrador. This was something that was announced a few weeks ago. You can expect this the first week in June. And of course, those that are eligible for the old age security pension along with the guaranteed income, you'll receive this special one-time tax-free payment. You don't have to apply. It will be issued automatically to you, and there will be a few $100, nearly $900 more for single seniors and $1,500 for senior couples. And that's, of course, on top of the existing benefits. And there's also some support for seniors at a $300 level who will receive this payment from the OAS and so on. So there's quite a few benefits there for seniors that are impacted by this. You will receive this benefit, as I just said, the first week in July. Also, there's more information on the provincial and federal supports and resources available. All of that, as I just said, is available at our COVID website. Now, so as we now look ahead into what is becoming summer in Newfoundland and Labrador and a long weekend, this weekend, the Provincial Park Day Use Activity and Campgrounds, well, that opened last Friday. This Friday, overnight camping at 13 provincial park campgrounds will be permitted. Campers, however, are encouraged to visit the nlcamping.ca to make a campsite reservation and inform yourself of the restrictions. You'll see some changes, but all of this is to protect you and make sure that you have a good time safely. We are also have made some changes coming to the COVID briefings. Dr. Fitzgerald mentioned if all goes well, we will be moving to Alert Level 2 next Friday, and this is something that I know everyone has been looking forward to, so that'll be on June the 25th. If all goes well, move to Alert Level 2. So our next COVID briefing will take place a day before that, which is Wednesday, June the 24th at 2 p.m. So that's essentially a week away, next Wednesday on June the 24th. So if you don't see us, so you won't see us here on Friday, And Monday of this long weekend, as we're moving into a new COVID briefing schedule, that'll be once a week. We feel as we start relax some of the measures, it's also important that we give people an opportunity to get out and enjoy some of the summer events. But also, I will tell you, there's a lot of work that comes in preparation to support businesses and local groups to get ready for the reopening. So it puts a fair amount of pressure internally on our public health officials, and we just want to make sure that they have the necessary time to get the balance into work life and coming to this panel, but also get the information out to those of you that need that information. And of course, all of this, unless things change, this is what we will put in place. But I can assure you that if we need be, we'll be back at this table. Unfortunately, that would mean that people are not compliant. So the best thing you can do is be compliant, and you can get out and enjoy our province as we should. So next week's briefing will be Wednesday. It'll be a full hour at 2 to 3 o'clock. So on the days without briefings, we will put out an immediate news release giving you the updated information on COVID in our province. So we've come a long way, and we've come a long way in a short period of time. So let's continue to be responsible as we look to take a step forward, not a step back. Have a great long weekend, and let's keep our communities safe. Let's keep our families safe, and let's continue to make our province the best province in Canada to live and to raise your families. So I now take this opportunity to open it up to the media for today's questions.
Thank you, Premier. For the benefit of our speakers, we have 4 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Our first questions today are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Dr. Fitzgerald, this is for you. Earlier this week at the last briefing, you mentioned once we hit alert level 1, we wouldn't be leaving it until we saw a vaccine, and that the uptake of the vaccine would have to be good. I'm wondering what you're deeming good, as we know that we're not very good at getting the flu shot or going out to vote and things like that. So what level of uptake will we need to leave level 1?
Well, certainly we know that a significant amount of herd immunity won't happen unless we get at least 2/3 of the population. We would like to get 80% or more of the population vaccinated. That would be our goal. It is, you're right, we've had not that kind of success with influenza, but I hope this year we will see improvements in our influenza rates, because it'll be important to get vaccinated for influenza regardless if we have a COVID vaccine or not, because reducing the risk of influenza is also going to help protect you, but not against COVID, but against influenza, and protect you from getting sick, but also help to reduce any strain on our healthcare system. So, hopefully we'll see a better uptake in influenza this year, but yeah, we'll be looking at a high uptake of COVID vaccine.
Yeah, so Kellyanne, just a bit of information. I'm just drawing on some experience, so I hope my memory serves me correct on this one. Is I think back in the H1N1 vaccine times, I think Newfoundland and Labrador, by the way, was kind of the second highest in the country. So we did okay with that vaccine, and I know you're right, absolutely right. I would encourage people to access the influenza vaccine this fall. But you know what? It's important for all of us to protect ourselves, but to protect our families as well.
And just to clarify, so if a vaccine does become available, we're not going to leave level 1 until we hit near 80%, essentially having to tie our freedom out of alert level 1 with having to get the vaccine.
Well, I that's a ways away, and I certainly don't want to make predictions this far out. That's our goal, is to get 80% of people vaccinated, and hopefully, we'll get somewhere close to that, but we'll see what happens.
And my final question, Premier Ball, it was noted in the House that we're looking to go back to in-class for September when it comes to K-12. Should our post-secondaries be looking to follow suit? We still have some programs that need hands-on that aren't operational right now, when we're seeing some are, as in Carpentry can, but some rows can't.
So I think your question was starting to break up there near the end. You're talking about post-secondary education going back into in-class in-class supervision, you mean?
Yeah, should they
Yeah.
be following suit knowing that that's what elementary and,
You know,
and
people
high
are-
school is looking to do?
Yeah, it's a good question. I mean, people are preparing in different ways, and we see Memorial University and CNA and some of our private, our private educational institutions. You know, they're looking at the fall, and they've, I think, from what I gather, they're putting in programs right now that if they can do, do those courses remotely and do it effectively. You know, that is the way that they're looking at. That's the delivery model the model they're looking at. From a K to 12 situation, it's very different. It's very difficult from a K to 6 as a student to, especially when you get K or play based up until grade 3. It's very difficult to do that remotely. So you will see, and hopefully, you know, our province stays safe, and we see low numbers, and we can get our K to 12 system back, you know, with in-class supervision. I think you can anticipate and see even, you know, prepared for what an outbreak would look like from the education system. But the post-secondary education institutions, they feel very comfortable now that they can deliver those remotely. It's much easier to do that with older students than it is for younger students.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hi.
Hi, Peter.
Doctor, how are you? Dr. Fitzgerald, on Monday you mentioned face masks, and you talked about showing tolerance for those who may not be wearing them for various reasons. And it's ironic because I'm literally getting schooled online at this moment for trying to iterate the government's position on masks. Do you feel that there's sort of a half-measured kind of endorsement in Canada? Is that serving to kind of polarize people's views about them?
In general, do I feel like there's a...
The policy on masks is half-hearted, to put it one way, in the sense that, yes, we do recommend them here and there, but there's no firm mandate. Do you feel that should change, or whether people should lighten up, or what is the government position when it comes to masks and only recommending them rather than making them mandatory?
So, you know, the evidence on masks, there does appear to be some benefit with wearing masks to reduce the spread of respiratory droplets. This is new. We haven't really had to consider this question before. So the information is new, the evidence is new, and still developing and evolving. So I think that's where you see difficulty with making hard and fast recommendations. But we certainly, at the moment, we're recommending it in situations where you can't physically distance. And I think that's what most places are recommending at this time. And so I don't know that there's a discrepancy really in what anyone is saying across the country. It's more just that, you know, we're learning as we're going along, and the evidence is evolving, and so we're trying to respond to that and to use the best evidence that we can.
Okay. And as follow-up to that, just for an example, if you go into a store and there are only, say, a third of the people or less wearing masks, are they useful at all in that kind of circumstance? I mean, is it similar to a kind of an immunity situation?
I don't know if anyone has studied that question in particular, but I think certainly anytime you have a reduction in the amount of respiratory droplets that are happening, I think that would be beneficial. The level of that benefit or the extent of that benefit, I think, I don't know that anyone has the answer to that at this point.
Okay, thank you. And my last question is with regard to the travel ban, the infamous travel ban. There's some suggestion that with so many exemptions being granted, as opposed to it being more strict, there's some question as to what the purpose of even having one is in the first place when a handful of people are being discriminated against and so many others are allowed in.
So when you look at the travel ban, Peter, I think there's a couple of things that we must keep in mind. Is when that travel ban was put in place, it was really then to prevent or try and prevent, someone coming into our province that could actually bring COVID into Newfoundland and Labrador, which would then lead to, the spread within our province. So that is why the travel ban was put in place, to just reduce the spread of COVID and try to prevent it from coming into our province. You know, we all know that when you look back over the history in our province in the early days, it was travel related. So this was just a measure that was taking place with a special order given that we were in a state of emergency and still are. This was a measure that was put in place to protect our province and therefore protect our most vulnerable. We know the history of what's happened across our country, the high instances of numbers related to this and the impact of that on seniors. So this was really about protecting Newfoundlanders and Labradorians. So, as we, begin safely to move across our province, we just continue to monitor, continue to look at the indicators, continue to look at our acute care settings and hospitals to see if we have the capacity to respond, make sure contact tracing is in place, testing is there. So, it is a bit complicated, but all of this has been working for us. Let's not forget, this has been working for Newfoundland and Labrador, and now as we start to open up our economy and open up our province, people will then be able to safely move back and forth. And then decisions and determinations will be made based on where things are at that present time. We shouldn't get too far ahead of ourselves here. We're seeing schools close in Beijing today and other parts of the world where we're seeing, more serious outbreaks. That's what we're trying to prevent, just keep people safe.
Thank you.
Our next questions are from Ariana Kelland of CBC News. Please go ahead.
Good afternoon. I'm looking for clarity on what level alert level 2 will mean for gatherings. Right now on your website, it just says that it's to be determined. So what will that mean for next week? And are we also going to start getting away from bubbles now that we have almost reached alert level 2?
That's two good questions. Certainly gatherings, we are looking to increase gatherings. Right now we're looking at increasing that to up to 50. But there will be some cautions, and certainly any indoor gatherings that are happening in your home, that wouldn't apply to gatherings in your home, that would apply to distanced gatherings, and that's how we'll be referring to them, as distanced gatherings, so that people are maintaining physical distancing, and that would be something that you'd have to consider. So it's not like a party of 50 in your house. It's really about making sure that we're thinking about this in terms of some kinds of sorts of ceremonies or things like that, where you would have adequate physical distancing, and then outside, again with physical distancing, gatherings of up to 50. And now I've forgotten your second question.
There's the bubbles.
The bubbles, right.
The bubbles. Yeah.
Sorry. Certainly we're now, I think people have gotten used to the bubble, meaning the people who are your close contacts, and I think it's okay to continue to talk about it that way, but our messaging will be certainly to keep your contacts outside of your close contacts, to keep those contacts as low as possible, so that you reduce the risk if we do start to see transmission of COVID within our communities, that you will reduce the risk of spread.
So would it be fair to say that we will kind of transition away from a specific number, but try to limit it as best you can and make sure that you know who you are actually in contact with? Is that
so? Certainly, yeah. So that has to be the messaging going forward. But we want, I feel like bubbles have meant something to people. People understand what that means, and so. I don't know that we'll get away completely from talking about bubbles when we're talking about your household unit, your very close contacts. But really, we have to start thinking about moving forward, navigating through the next few months, and trying to keep our contacts outside of our bubbles as low as possible.
So I think underlying all of this is an area of common sense and responsibility for everyone. Just use and practice, the same things that we keep talking about every day, hand washing and safe physical distancing and so on. So, when you put all this together, and as, Dr. Fitzgerald said, we can put numbers in place and try and restrict numbers, But, anytime you get a gathering and anytime you get, anybody, I guess, over 2 or 3 or whatever the number would be, there's a risk. And, we've been successful simply because we've had good compliance in Newfoundland and Labrador. And people in our province deserve the credit for that. So just continue to be responsible, continue to use good common sense, practice the safe health guidelines. We want to continue making progress in our province, but we realize that as we live with it, we could anticipate and expect that we will see it at some point where people will be reporting positive cases of COVID at this table again.
Thank you. And my second question is for Dr. Fitzgerald as well. We heard from a radiologist from Central Health this week who said that doctors may be recruited from COVID-19 hotspots like California. Do you see any issue with that? Is it wise for health authorities to be recruiting doctors from areas such as California and Great Britain where they do have more cases?
So I think, anytime you're talking about recruiting people from other places, there are things in place to make sure that this can be done safely. There's self-isolation and other procedures. So, I can't really comment on the inner workings of the regional health authorities. That's not really my position, but certainly there are ways to do it safely.
Thank you.
Our next questions are from Tyler Dunn of VOCM News. Please go ahead.
Thank you. It's great to hear about film companies resuming in this province, but how will those working on shows return to the province? Like, will they be subject to self-isolation? And what was kind of the thought process behind allowing filming to resume?
Filming companies have reached out and they have plans. They have engaged with medical personnel to be able to develop plans to ensure that their sets are safe and that their actors are safe and their crew are safe. And they have put all of those plans in place to make sure that they can keep a safe workplace. And so all of those same rules apply, that they have to maintain a safe workplace. And, if there's any concerns, certainly they know public health and they know how to engage if need be.
Okay. And again, with the announcement of the switch to level 2 coming next week, I know you talked about guidelines being worked on, but are we any closer to knowing when these more detailed guidelines will be released, as people only have about a week to prepare to reopen now?
Yeah, so many of the guidelines are going to be simply updated, because some of the ones have been out there already. And we've certainly started engaging with a lot of these groups to talk to them about what's going to be happening and what'll be recommended in that in level 2. So even though the guidelines are not up on the web right now, it doesn't mean that we haven't started the engagement process and we haven't started talking about that with these groups. So there is all of that happening behind the scenes before you see these guidelines go up, because we want to make sure that we're getting feedback from those groups to make sure what we recommend is doable and is in keeping with what they'll be able to do.
Just remind everyone again, too, that we're watching this and would have questions. The COVID website do have some posters that are very effective and adds a level of consistency through all businesses of what some of the standard, consistent messages would be about living with COVID. So it encourages businesses and organizations to go and visit that website and print those off too. They're very useful and gives a consistent view of what's happening within our province with those health guidelines.
Okay, and to the both of you, what do you think the biggest changes and challenges are going to come about when the second last alert level does happen next week, if everything remains the way it is?
Well, I think there's almost been a sense of, people have felt, I think, that they've been, kept inside, and they realize for all good reasons. I get an extraordinary number of people that reach out, and I sure Dr. Fitzgerald too, because she's copied on a lot of them, of people that are very thankful of the fact that we've been able to work together to keep this province safe. But we also recognize there comes a time then when people, will need to get moving around, because there are other health issues that you need to consider, as I've just mentioned, about mental health and so on. And just people want to be active. They want to get out. They want to be social. They want to engage with their friends and neighbors. So we're now into the third week in June. We've been reporting 0 cases for, almost 3 weeks now, very limited numbers for really a couple months. So people are now just ready to move a bit. But I think in the backs of people's minds, they also know that that the world has changed and the way we socialize has changed quite a bit. And they're willing now to, practice those guidelines, those health guidelines that I've just mentioned to continue to protect themselves, realizing that that when you look at the news every night and you see what's happening around the world, this virus still exists within our communities, within our world, within our country. So there's always I think this sense of awareness that this could come back, but we now know after going through this first wave how to respond better. I mentioned Pandemic 101. That's essentially what it's been. We've learned lessons from other jurisdictions, and jurisdictions have learned lessons from us. So there's more information out there. And we got to respond to a second wave. I think, that we're better prepared to do that simply because we've been through this first wave.
Thank you.
I think we have time for one quick question from each reporter before we sign off today. We'll start off with Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Premier Ball, it's been spoken by many now looking for the financial impact that this pandemic has had on the province. But I'm wondering, has the province been monitoring or any way of tracking to know the damage that some of these measures has caused for others in terms of mental health, underlying health conditions that weren't able to be treated, food security, those issues? How are we monitoring that?
Yeah, very difficult to do that. What we can monitor is, as I just mentioned, the number of people that would have reached out, and as I just mentioned with the kids' help phone line. And we have a wide range of supports for people. And we certainly track those, have the numbers. There's no question that people have used those resources. We promoted them even at this panel and encouraged people if they need help to reach out. There's no also around food banks and so on, supports have been put in place. So how you monitor that, on a day-by-day basis is not always easy to do. As I said before, I leave as Premier of this province. I'm going to give a financial update, near the end of July sometime to the province. We have put in place a $200 million contingency fund to support organizations in the business community and individuals in some cases. So we're literally less than 80 million of that used right now. We'll continue to update the province on that. But the biggest challenge that we're facing from a province's point of view and financial situation is the loss of revenue. And it's been substantial. We all know for the reasons for that. But, when we compare ourselves to other provinces, I think we stack up there quite well. We were in a difficult situation going into this, and that has kind of exaggerated the situation where we are. I understand the federal government will come out now the first week in July and give some kind of an update on the federal financial picture. So it's all connected, but every province has been affected. Every country has been affected by this pandemic. So I don't think there'll be any surprises. That has had a major financial impact. It's just the magnitude of it that we need to get out here and articulate.
Thank you.
Our next question is from Peter Jackson of The Telegram. Please go ahead.
Hi. This has been asked dozens of times, but I still want to clarify. With so many businesses that are opening being forced to go to half capacity, physical distancing, all that, a lot of people, parents and operators, are wondering why are daycares, one parent would call it basically a petri dish. Why would daycares not be forced to be in this situation that just about every other business is?
You mean right now daycares or child care centers are at 70%? Are you suggesting they should go back to 50%?
Well, considering every other business pretty well has to do that.
Well, restaurants would be at 50%. Other businesses, have made a determination based on their footprint and the risk assessment that they would have inside their businesses, how many people that they would allow within stores. So I think things have opened up considerably. We also recognize that as people move back to work, they would need to have access to childcare services. That was one of the reasons why we expanded childcare centers or childcare so that people could actually find their own independent and often family members to support them. We did that with up to $200 a week. So right now we're at 70%. That will grow again. as we get into alert level 2, recognizing that as people go back to work, they're going to need access to childcare spaces, and the owners themselves have been working with public health officials to be able to do that safely. So, that's what reopening an economy brings with it. People need access to childcare, and we still have a number of private settings too, which is allowed in our province for people to use as childcare as well. So it is living with COVID. Making sure that we have access to childcare is a part of that.
Thank you.
Our next question is from Ariana Kelland of CBC News. Please go ahead.
Churches are permitted to resume during level 2. What do you expect that will look like?
Did you say churches?
Churches, yeah.
Churches.
Yeah, so certainly we'll be engaging with leaders in the faith community in the coming days to look at how that will look. Certainly, there are limits with regards to gatherings, and so the number of people that will be allowed and be able to be inside, and there will be some recommendations with regards to spacing and how that should be. Singing has been identified actually as a method of increased risk of transmission. And so it's been a concern in a lot of areas, and that is something that will have to be addressed as well. So there may be some changes to the way that services are able to be carried out. So there's a bit of discussion that has to happen, and certainly we're hoping to be able to engage with leaders so that we can make that happen. We can ensure that everybody is kind of on the same page and understands the rationale for the recommendations.
Thank you.
And our final question today is from Tyler Dunn of VOCM News. Please go ahead.
Thank you. And this is just a little bit to add to Kellyanne Roberts' original questions. A recent poll from the Association for Canadian Studies suggests about 16% of the Canadian population won't get vaccinated if and when a vaccine is developed. I know you said 80% is the target, and that's, of course, below that. But what are your thoughts on as much as 1 in 6 Canadians not taking part?
So I think, in Newfoundland, we've always had a good uptake of vaccines, certainly in our childhood vaccines. We have one of the highest, if not the highest, rates of childhood vaccination in the country. I think people recognize the importance of being protected against this virus in particular, given its rate of severe illness and the fact that we have such a naive population when it comes to this virus, immunity-wise. So I think that Newfoundlanders and Labradorians have always stepped up and taken responsibility for their health when it comes to vaccination, and I think that we'll see the same thing with COVID.
Okay, great. Thank you.
Thank you very much, Dr. Fitzgerald. The time for questions has ended. Please join us again on Wednesday, June 24th at 2 p.m., 1:30 in most of Labrador. Have a great evening.